Hello and welcome to York County. I'm your host, Lynne Fitzgerald. Joining me today is John Forte, President and CEO of RiverStone Health here in Yellowstone County. Thanks for being here. Appreciate you coming on. I know you've got a lot going on these days in public health, always.
We do. Thanks, Lynn.
Yeah. So can we go back and do just a mini history of RiverStone Health, how it came to be, why it came to be?
For sure. Yeah. This year we are celebrating our 50th anniversary as an organization, as your Yellowstone City County Health Department and RiverStone Health, and our 40th anniversary as your federally qualified community health center. You know, starting from the small Deering Clinic on the corner of 27th.
Oh, yeah.
We've blossomed into the campus you can see behind you today.
Right.
Just an incredible journey taking care of the life, health, and safety of Yellowstone County residents and our eastern Montana region for the past 50 and 40 years.
Well, what is the federal designation? Why is that important?
So our Community Health Center, or Federally Qualified Health Center, known as an FQHC, that is the part of the organization that provides direct healthcare services. And so we are one of very few public model health centers across the country where our organization, the Yellowstone City County Health Department, is able to provide direct provision of care. So primary care, medical services, dental services, full scope dental services actually, as well as behavioral health services.
Right.
And so you've come to RiverStone Health and we can meet your healthcare, behavioral health, and dental health needs.
Wow. Without that designation, what would you be limited to providing?
So the really important piece to that designation is that it allows us to receive federal funding to take care of folks regardless of their financial status.
Okay.
It allows us to implement a sliding fee scale based on individuals or families' income. And it also allows us to take care of folks that may not have any insurance coverage or any money to their name. And so regardless of your individual financial status, you're welcome at RiverStone Health.
Do you have any idea, I'm sure you do, of the number of patients that you serve in a year?
We serve about 14,000 patients in our clinic.
Wow. Yeah. And many return, I'm guessing?
Yes,
okay.
Absolutely.
So there's ongoing care for a number of these individuals.
Correct, and that's also the other beauty of being a community health center is providing all of the wraparound services, whether it's referrals to our hospital partners up the street or individualized service, folks who need wraparound services like transportation or referrals to other community agencies and nonprofits for food insecurity, or working with School District 2 to make sure that kids stay in school, providing other services like health insurance and helping people find insurance coverage on the marketplace. We can do all of that within our community health center.
Well, RiverStone made news not too long ago, not great news, because of I don't know the terminology, the disentangling of Medicaid. What are they calling it?
The re-enrollment
re-enrollment.
Unwinding
process. That's it, the
yes.
unwinding. Well, in a nutshell, a lot of people were cut out of Medicaid. They lost Medicaid coverage. And how did that impact RiverStone?
Yeah, so what we've seen, Lynn, is about 133,000 Montanans were caught up in this re-enrollment process and redetermination. And so on an annual basis, before the public health emergency, before the pandemic hit, Medicaid redetermination is the law of the land. And so states on an annual basis redetermine if an individual is eligible for Medicaid coverage heading into the next year. During the public health emergency in COVID, we had 3 years, 4 years of a pause in that redetermination process.
I see.
And so what we saw...
Why did they pause? Just because of...
Because they wanted to make
it?
sure that no one lost coverage during the global pandemic,
Okay.
right? And wanted to do the right thing.
Yeah.
And so the federal government told states, you know what, we're going to pause on this redetermination annually so that nobody loses coverage while they could be sick or ill or impacted by the pandemic. And so the beginning of last year, CMS told states, well, now you have to go and redetermine folks again and make sure that your Medicaid rolls are accurate, that folks who are on and receiving Medicaid coverage need Medicaid coverage, and certain folks during that time period either became employed and received health care coverage through their employer.
Sure.
Perhaps they were of Medicare age and turned 65 over that 3-year period. And so now they're eligible for Medicare. Medicare is the full federal program where the federal government provides folks who are over 65 or with a long-term disability that Medicare coverage. And so they would get off the Medicaid rolls, where Medicaid is for children, for families, for pregnant moms, for individuals who meet an income threshold, about $35,000 a year annually for a family of 3. You and I both know that is not a lot of money. And so that's where Medicaid comes in to provide that safety net for children, for families, for folks that are low income. And right now in the state of Montana, the federal dollars match us about 80-20%, almost 90-10%. And so the federal government is providing billions of dollars to the state of Montana for the Medicaid program, which is saving Montanans about $28 million a year in our state budget.
Wow.
And so it's an economic driver, and that's why it's so important.
Yeah. But because so many people lost Medicaid coverage, that had a direct impact to your organization and your bottom line.
Absolutely, yeah. We, with the redetermination process, as things rolled out, unfortunately, we saw a drop of almost 2,000 patients off our rolls and off, coming into the clinic.
A direct result of losing Medicaid coverage?
Correct. Okay. It's a direct result of those folks being redetermined or being lost in the sauce and getting lost in the process. And so about 70% of all Montanans who lost or were determined as ineligible in the start of this process were redetermined for procedural reasons. Perhaps they didn't get the letter in the mail from the health department, the state health department. Perhaps they didn't understand what it meant, that they had to reapply and re-enroll in Medicaid coverage. For many folks, our native population, who may have P.O. boxes on the reservation to qualify for those benefits, many Native individuals don't check those P.O. boxes on a regular basis.
Okay.
And so that mail was delayed and didn't get delivered, and they may have not have reapplied for Medicaid coverage and been kicked off the rolls.
Were people made aware that they had to reapply? Was there some kind of public campaign or push to announce that this was pretty important?
So together with all of the 13 community health centers across the state, the Montana Primary Care Association, RiverStone Health, many other community health centers, Cover Montana, which is our re-enrollment grantee that helps folks get marketplace coverage, re-enroll in Medicaid or enroll in Medicare. We did a public campaign and reached out to our patients. The 1 in 10 Montanans that our community health centers serve, we're reaching out to our Medicaid patients directly and saying, hey, you're going to receive a letter. You might get a phone call. Please be on the lookout for this. You need to reapply for Medicaid coverage so that you don't lose your valuable health insurance.
Yeah, but in the meantime, it's hard for you to gauge if the message is hitting home because they don't apply to you.
Right.
They apply to the feds or the state?
To the state.
Okay.
So through the state Medicaid office with DPHHS, they can come, and anyone currently needing Medicaid coverage or just health insurance coverage in general can come to RiverStone Health. We have 4 certified re-enrollment specialists, application specialists that can help
that's
with this
huge.
process.
Yeah.
And so you can come to RiverStone Health during normal operating hours, and someone there can help you re-enroll and get re-enrolled in Medicaid coverage, or find you a health insurance plan on the federal marketplace that could be right for you.
Could they also tell you if you're eligible for
Yes.
Medicaid? They would know that right off the
Yes.
top.
Absolutely.
Right, okay. So the people who maybe missed the deadline or got caught up in the paperwork shuffle, can they reapply?
They can.
Okay.
Absolutely. Absolutely. And so if you were to apply July 1st, for instance, and be determined eligible sometime towards the end of July, there's a 45-day period in which the state has to determine if you're eligible or not once you apply. The coverage date starts 30 days before you are actually deemed eligible. And so it can actually go back and retroactively and cover health services that you may have received while you were waiting to see if you were eligible.
So is this an open window concept? You've got an enrollment period of so many days or weeks a year? Or can you do it anytime?
You can do it anytime.
Okay.
Anytime.
Okay.
So if you need health care coverage, you can come to RiverStone Health.
Anytime.
You can call Cover Montana or go to covermt.org and find an enrollment specialist where you live. We have folks out all across the state through Cover Montana and the Primary Care Association. The hospitals can help assist with the process. So anybody looking for coverage can get coverage, through their community. They're even having virtual appointments through virtual aides who are helping through Cover Montana. Yeah.
Okay. Well, the impact, though, to RiverStone was pretty significant. You lost a number of positions.
We did.
A lot of people, actually. Was the total number 42?
So the total number over the course of this past fiscal year was 42, or about
That's a huge chunk.
9% of our workforce, yes. And so we saw the impact coming, early on in the year.
Yeah.
And we walked off this fiscal cliff, if you will. And this redetermination hit us incredibly hard. Our patients who lost Medicaid coverage were still coming to see us. We are never, ever going to turn anybody away at RiverStone Health. That is the beauty of a community health center.
Right.
But it hit our bottom line to
Well,
the tune.
fiscally, you're providing the same service, but you're not getting any income for it.
Correct, correct. And so we're not getting any income. We're still treating patients and meeting their needs. And so that resulted in about $3.2 million hit to our bottom line.
Yeah. As the president and CEO, you're the guy that has to make the tough decisions,
Absolutely.
Right? How well were you sleeping during that time?
We tried to make as compassionate, empathetic, and data-driven decisions as we could. And in a situation like this, there are no good decisions. There are only hard decisions. Right. We've got an incredible team at RiverStone Health, and working with our managers and directors, our senior leadership team, we worked through day and night data and making sure that the programs and the positions that were impacted were not only going to minimize impact to the organization, but it was going to minimize impact to the services that we could provide to our patients.
Yeah.
And making sure, at the end of the day, we had to make these hard choices because as we celebrate 50 years this year and 40 years in the clinic, we want to be here for the next 50 years and the next 40 years. Yeah. And we had to ensure the sustainability of RiverStone Health.
Right. And you talk about it like a team. It's a team. So there are personal relationships among team members. I mean, they're friends, they're family, they're whatever. It had to be hard on the entire staff, not just those losing their jobs, but people who kept their jobs.
Absolutely. No, it's one of the one of the things that got me to come to RiverStone Health was just the culture of the organization and that incredible teamwork and the environment that we have. You know, we are all mission-driven individuals who want to take care of this community. We're all passionate about the work that we do, and that's what connects us. And so there's a lot of survivor's guilt right now among the organization. As you know, last Friday was the day that was the final day of folks whose positions were being cut. And so as we move forward, you know, it's my job as the leader to be ever optimistic about the future of the organization. And what are we going to do to sustain the great care that we provide to this community and save the public's health? And so right now it's about taking care of the folks who had to lose their positions, and also take care of the folks who remain and continue to build that team and protect our culture and protect who we are, because people care so deeply about one another and care so deeply about this community. And so we've engaged in a lot of resiliency work and a lot of well-being work, and we're bringing folks together in focus groups or support groups maybe to share. You know, we're all in this together. We're all feeling down and out, and we're feeling like we lost some really good friends and really good colleagues. And so how do we move forward? How do we rebuild? And we will. And we're going to chase new opportunities to take care of our community. We're going to re-enroll patients who've lost coverage. And we're going to move forward into the future stronger than we have been.
Well, I appreciate what you said about being here for the next 50 years. And that is probably a real strong point of your vision in making these tough decisions. In order to be here for 50 more years, this has to happen.
Right.
Yeah. So, what is happening now that you're moving forward? Is the team as efficient? Are any things being dropped through the cracks?
You know, we're doing everything we can to make sure that not a single patient gets dropped through a crack, right? And so our focus is on patient care. Our focus is on the clients that we serve, whether it is in the clinic or whether it's through public health. You know, our home visiting programs, for instance, immunization programs. We are ramping up as a result of the closure of our inpatient hospice program, our 12-bed hospice home. We have expanded our care in home care and home hospice across the community, trying to meet the needs of more patients who need compassionate hospice care in the comfort of their own homes. And so we're doubling down on hospice. We're doubling down on home health, trying to meet patients where they are across this community. We're going to continue to expand opportunities in school-based health centers, working closely with Dr. Garcia and his team in SD2 to try to meet students' needs. Our kids need behavioral health access. Our kids need medical care more than ever in 2024. And so we want to be the folks that meet that need here in the community. And so we'll be expanding our school-based health center program into the future and getting out there into more schools across the district. We're looking constantly at grant opportunities, and there are some large federal grants right now. There are also some great public-private partnership grants that are available through philanthropic organizations, and so we're pursuing those as well. We recently just got a great gift from the Bear Foundation to protect our home-based staff who are out there in the community. And now they have access to an alert GPS system that'll keep them safe and provide a direct line of communication to home base in the event that they run into an emergency or need help.
Yeah. I'm wondering, do you think grants will be more generous since the pandemic? Are you seeing that? Is any correlation at all for public health?
I wouldn't say there's a direct correlation. If anything, as a result of the pandemic, public health across the country has seen funding drastically cut.
Well, there was a lot of criticism. It was
Yes.
just one of those situations where, well, you're certainly more aware of it than I am.
Sure.
But there were two sides on that COVID story. Two
Absolutely.
sides.
Absolutely. And we need to do better as public health professionals in communicating, in educating, in sharing the rationale behind our decision making, and being more clear and getting the message out more effectively. And so we've learned a lot from the pandemic.
I was going to ask you that.
From a public health perspective.
What kind of playbook are you looking at now?
You know, it's about being more intentional in delivering the right message. You know, the pandemic taught us that, again, just like we had to do for the sustainability of RiverStone Health, there were no good decisions to be made. During the pandemic, if you were a public health official, there were no good decisions to be made. At the end of the day, whatever decision you made was impacting somebody's individual freedom.
And challenged.
Absolutely. And so the challenges we faced, I hope we don't have to face again, but the truth is, in 2024 and beyond, there will be additional infectious diseases that come our way. There will be additional public health challenges. That's just the nature of living on planet Earth.
It is, yeah. Well, how do you keep a beat on those things, on trending, I don't know, medical issues or conditions that may be affecting public health?
For sure. So we have an incredible public health team. As your local health department, we have environmental health professionals who are monitoring air quality constantly, working on permits and making sure that septic systems and wells are safe. Our drinking water across the city of Billings is safe to drink. Public pools are safe to swim in this summer, right? Making sure that restaurants are safe to open and serve food, correct? And so we work through all of these things behind the scenes to make sure that Yellowstone County is a safe place and a fun place to live.
Yeah.
And at the end of the day, for me, it's all about a strong economy. And that's why Medicaid is so important. Getting people access to health care coverage creates a stronger economy. It keeps people at work.
Sure.
It allows people to access health care. And it provides millions of dollars, hundreds of millions of dollars of direct economic impact to this community. So a healthy workforce, a healthy Yellowstone County is a vibrant Yellowstone County.
Okay, so I'm going to get a little personal. What drives you? Why did you choose public health?
Well, I've been in healthcare for a long time now. I started after graduate school working for the VA. And I spent a decade in Department of Veterans Affairs and VA healthcare. And I just saw such a need. VA is our health safety net across the country for veterans who need healthcare services. And the need was great. The troubles were great. The bureaucracy was great. And I saw so many challenges across the country. I had the opportunity to work in Washington, D.C. For the VA for several years, and I could see even a divide between our coastal cities and the resources that were there, academic medicine and things of that nature, and the middle of the country and the rest of the country. And growing up in rural Northeast Pennsylvania, I've always had this desire and passion for rural community health. And I was at a rural health conference in eastern North Carolina one day, surrounded by tobacco fields and cotton, and was listening to a speaker, and I had an epiphany, and I left the VA, and I said, I need to work in community health and public health, and I need to work in rural communities. And so I left North Carolina, went to the eastern shore of Maryland, and started there a couple weeks before the initial pandemic hit. Worked through.
Welcome to public health.
And that was and so that was the initial groundbreaking to my public health career.
Wow.
And then I got a call from recruiter and said, what do you think about Billings, Montana? And I found RiverStone Health. And the beauty and that connects to my passion is that RiverStone meets so many different needs across our community, from life to birth to death, and everything in between. It touches, in public health we talk about going upstream and going downstream, and prevention, and meeting people where they are, taking care of direct patient care and service delivery in our clinic, to preventing disease and creating safer spaces, making the healthy choice the easy choice, doing all of those things to create a more vibrant community, better parks, recreation, art, crosswalks, stop signs, right? All of the things that people don't, folks take for granted. A lot of the things that public health provides to our lives. And that's what keeps me energized, is sharing the message of what public health actually is.
Right, it's a lot.
What healthcare actually is, and how we can meet folks where they are, how we can build trust across communities, and get folks to live healthier, more productive lives.
Okay, well, welcome.
Thank you.
Hope to see you around for a while.
For sure.
All right. Thanks again for
Thanks,
joining us, John. And thank you for joining us on Your County. I'm Lynne Turner Fitzgerald. We'll see you next time.